10 days ago, I was pleased to celebrate the feast of St. Luke the Evangelist with Mass at the cathedral. Gathered with us were some healthcare workers, primarily those from nearby Rapides Regional Medical Center. And today we gather here at Cabrini Hospital to celebrate the feast of Saints Simon and Jude, apostles. Tradition tells us that St. Luke was a physician, so he is naturally the patron saint of physicians. St. Simon, as we heard in the gospel, was a zealot, a political activist. So though we honor him, he's not exactly relevant to our celebration today. And yet, politicians seem to exert great influence on healthcare decisions, perhaps too much influence. So maybe we ask St. Simon's intercession with those who step out of their lane, so to speak. Though presumably not a physician, St. Jude is one of the patron saints of impossible causes and is therefore also the patron saint of healthcare workers. The physicians among us know that their skill and expertise is in diagnosis, in treatment, in determining what is wrong and finding the means to correct the problem or reduce the burden of the issue. But the physicians among us, I hope, will recognize that the task of healthcare goes beyond diagnosis and treatment. It involves the whole person and patients. Those whole persons are also aided, comforted, and supported by nurses, therapists, counselors, personal care assistants, and aides. In short, by an entire team devoted to care. And often, especially in these last 18 months, that task has truly been an impossible cause. In the years since St. Luke was a physician, in the years since Saints Simon and Jude walked with Christ on earth, medicine undoubtedly looked different than it does today. But I suggest to you that care and compassion look pretty much the same. It is care and compassion that abound throughout St. Luke's gospel. Only in Luke do we hear the story of Lazarus and the rich man. Lazarus, whose sufferings are overlooked and ignored throughout his life, is welcomed into God's kingdom, while the rich man, who cared only for himself, is denied the joys of heaven. Only in Luke do we find the story of the prodigal son, or more accurately, the story of the merciful father. After walking away from the family and squandering his inheritance, the son is welcomed back by his father with open arms. Only in Luke do we find the story of the Good Samaritan. After a robbery, a man is left injured on the road. Those who should help him pass by, but a stranger, a foreigner, tends to him, binds his wounds, and sees that he is cared for. In Luke's gospel, Jesus often speaks for and to the powerless in society, including in Jesus' time even more often than ours, the powerless included women and children. Yes, Luke's gospel is filled with stories of care and compassion, mercy and forgiveness, kindness and love. All of the gospels seek to instruct or uplift or draw the reader toward Christ. Not surprisingly, Luke's gospel uniquely introduces us to Christ the healer. Through the intercession of both St. Luke and St. Jude, Christ the healer continues his presence among us. Many of you know that I come from Memphis, Tennessee, home of Elvis and barbecue, the blues and rock and roll, and in particular, St. Jude Children's Research Hospital. The particular mission and ministry of that hospital is the research and treatment of catastrophic illnesses that impact children. I have seen the hopeful, life-giving impact of their work in the lives of my neighbors, classmates, and friends over the years. And I have seen similar dedication and devotion from the healthcare professionals here at Cabrini. In the last year and a half, we have become increasingly aware of the vital role that all involved in healthcare play in our society. From promoting good health to binding the wounds of injury to treating any number of diseases, even those viruses and their variants that come suddenly and without a roadmap. Doctors, nurses, therapists, dietitians, specialists, and aides work together to treat their patients with skill and compassion. In these past months, it seemed many times that our healthcare system might collapse under the weight of the global pandemic. Strained though it was, the system has survived thus far through the self-sacrifice and commitment of many of you. Professionals who are still busy treating the sick and comforting the dying. In the gospel passage we just heard, Jesus first spent the night in prayer and then called his disciples by name. He would send them forth in mission, but only after establishing a deep personal relationship with them. Many of you see patients in the most painful, the most frightening, the most vulnerable moments of their lives. When possible, you seek to connect with them, always treating them as a whole person, not just as a body part. The care and compassion you show your patients eases their pain, calms their fears, and reveals to them the presence of our loving God in the midst of their vulnerability. I encourage you in your important and compassionate work. Each of you knows that your patients are much more than a collection of cells and DNA. Each patient is a unique child of God, an embodied soul who has feelings and intellect and emotions deeper than their pain receptors. Each human person has a dignity granted them by their Creator that deserves our respect. Thank you to all of you who treat and care for those whose bodies are racked with diseases or injuries or the effects of aging, but whose dignity remains intact. Thank you for your compassion in these stressful and overwhelming times. I know that there have been times in this pandemic when, for all of your skill and training, you felt helpless in the face of limited resources and a virus that seems to strike each person differently. Thank you for your perseverance. May our loving God wipe away your tears and enfold you in his gentle embrace. We ask God to continue to give you and your families and your co-workers strength in the face of this pandemic. You have always modeled for us the Good Samaritan, but never more so than in these last 18 months. May Christ the healer continue to bless you and the important and compassionate work you undertake for this community each and every day. Let us place our needs before our loving God.